Hello and welcome to today's Lunch and Learn. My name is Catherine Roberts, RN, and I'm really happy to have you here to learn about eliminating exposure to tobacco. And so we have a room here full of parents of children and their child care providers, and really excited to learn how we can eliminate some of this tobacco. A little about myself, I have been a nurse for 10 years. I started off in oncology, actually decided to become a nurse after my father's passing with cancer. So I want to tell you straight off the bat that tobacco is the leading cause of cancer. It's also the leading cause of death from cancer. So this is a very near and dear subject to me. From working in oncology, I went and I spent 7 years working in the emergency department. And now I currently work as a psychiatric and mental health nurse. I also have 2 children, so I've been exactly where you are at. I have a 15-year-old daughter and a 17-year-old son, and I know how much your children mean to you and how you want to make good decisions for their well-being. So I wanted to kind of bring up that I am a psychiatric mental health nurse because this has been a very difficult area to convert to quitting smoking. A lot of substance abuse, a lot of addiction in this field, and it's very difficult to get this patient population to quit smoking. So if you're struggling with quitting smoking, I have seen this as well, and want to tell you a little bit about something I've witnessed in my practice, because back in the olden days, it's in psychiatric hospitals, it was even common practice for staff to hand out cigarettes to their patients when they were upset to try to get them to calm down. If you see old movies, you'll see if they have pictures of counseling, AA, those kind of things. It's always sort of associated with that sort of chain smoking. So then we'll fast forward to 1992, and the Joint Commission that accredits hospitals made a ban for smoking in all hospitals and healthcare facilities. So it was a good thing. So now rarely do you see any smoking when you go into any of our large medical hospitals across the country. But there was such a pushback from this field, from psychiatric facilities and that patient population, that they actually made those facilities exempt from the ban. Not such a good thing. So it's been a struggle to try to get the ban for psychiatric facilities as well. But I'm here to tell you that I actually work for a psychiatric facility that has banned smoking, and it's working really well. We give patients patches and other things, and a lot of them leave and say, I'm never going to smoke again after they spent time with us. And one of the ways that has been successful for us is that I work for Banner Health, which is a very large not-for-profit healthcare organization. And they primarily have medical hospitals, so they weren't going to just make one facility smoking and another non-smoking. It's across the board. So I'm fortunate, and in this presentation I'm going to be citing a lot of information provided right from my work, because that is one of our core goals, is try to get people to quit smoking. So I know if you're struggling with smoking how difficult it can be, but it can be done. So if they can do it in psychiatric facilities, you can do it. So if you are a smoker, let's tune in, or if you know a smoker, tune into this little first part of my presentation here. There's a 2-part problem here with quitting smoking, and a 2-part problem if you have children. One is that early exposure to smoking may make your child start smoking. The other thing is that early exposure from secondhand smoke deteriorates the child's own health. So as parents of childcare providers, you know that the little kids are watching everything you're doing. It's really important that you understand that if you're smelling like smoke, the kids are going to associate that with your smoking. You may think they're not, but they're going to come to that realization. So it's important that you practice what you actually preach. Just telling them to not smoke is not going to work if you're smoking. So let's talk a little bit about children exposed to secondhand smoke. Some of the real hard research here is that they have increased risk of ear infections that can lead to long-term hearing problems. They also have more upper respiratory problems like bronchitis, pneumonia, asthma, which ultimately can lead to decreased lung function. Here's kind of an unusual thing, but they actually have more incidence of cataracts later in life from being around secondhand smoke, and more heart disease, more cancer, and even babies that have been exposed to secondhand smoke have an increased risk of SIDS, sudden infant death syndrome. So each day, 3,200 kids younger than 18 smoke their first cigarette. That's straight from the CDC. And we also know that 9 out of 10 smokers start before the age of 18. And that's from a fabulous website. It's called betobaccofree.gov if you want to look that one up. And another really shocking statistic, that 5.6 million children alive today will ultimately die early from smoking. This is equal to 1 child out of every 13 alive today, also from Be Tobacco Free. So as nurses, why do nurses of all disciplines want to help you quit smoking? It's because nurses are health advocates. Even going back to Florence Nightingale, nurses have pushed for creating healthy environments for their patients, realizing that fresh air is a hallmark, and a fresh, healthy environment will help their patients get well. And the American Nurses Association position is that a healthy environment is also a universal right for all, especially children, because they are the most vulnerable and need our protection. So another thing, if you travel outside of our country, you may have noticed that smoking is still very prevalent outside of here. And even the International Council of Nurses is committed to banning smoking in public places, and this is to safeguard us from the dangers of secondhand smoke. And that's attributed to 5.4 million deaths worldwide each year, and a lot of them are children. So nurses, we care about your health. So how do we do this? How do we raise tobacco-free kids? And so this is some information from Crame Stay Well. They provide healthcare literature. It's K-R-A-M-E-S, and this is from My Banner Health website and library. So first thing, quit, and we'll talk a little bit more about that in a minute. Start early talking to kids about the dangers of smoking. Ideally, 5 to 6 years of age is when they can start to grasp those issues. And then talk about the negative tobacco advertising that's out there. We know that $25 million per day is spent on billboards, commercials, everything to inundate us to take up the habit. Stress how much the cigarettes cost to little kids, because if they know that maybe they can get a new toy or video game, something like that, in lieu of what cigarettes actually cost, and kind of showing the different cost of one thing to another, they can start to identify with how expensive that can be. And then as teenagers, talk to them about how smoking is going to deteriorate their appearance, because appearance starts to become important to teenagers, and if they know that it's going to make their teeth yellow, their hair brittle, that they're going to have wrinkles later on, that may have an impact on them. And also know who your kids are around, know who their friends are, and also know the smoking habits, if possible, of their friends' parents. Most important, help your kids find self-confidence and self-worth. If they feel good about themselves, they may not feel the need to succumb to that kind of peer pressure. So if you do smoke, or if you know someone that smokes, ways that you can quit. So we have a two-part problem here. There's a physical addiction, and there's the psychological habit. So first thing, call the American Cancer Society. They maintain a 1-800-QUIT line. They can give you all kinds of information and resources in your area. So I'll give you this phone number. You can write it down. It's available after the presentation if you would like that. It's 1-800-227-2345. So once again, 1-800-227-2345. Next thing, you can join a tobacco cessation support group, which is really helpful to be around that environment of others, make you not feel so alone. They're going through the same thing you are. You can talk to your doctor about adjusting with some nicotine replacement. We have nicotine chewing gum, nicotine patch, there's nicotine lozenges, inhalers, nasal sprays, and then we actually have 2 oral medications that have been approved by the FDA and they're by prescription for quitting, and it's Zyban or Chantix. So you can talk to your doctor if either of those would be right for you. And then there's the basics. Eat a balanced diet, get a lot of rest, and eliminate stress from your life. That can definitely help when you're trying to quit. I also wanted, on a side note, talk a little bit about some Heart and cardiovascular risks. I think most people can make an easy association with the respiratory problems that smoking cause, but there's significant damages that can happen to your heart and cardiovascular. So we know that immediate and long-term increases in blood pressure occur. We also, from smoking, have an immediate and long-term increase in your heart rate. It reduces the cardiac output and your coronary blood flow. It reduces oxygen in your blood flow. It actually changes the blood vessels and allows fatty buildup, and which of course leads to increased risk of blood clots, and it doubles the risk of stroke. So all negative things here from smoking. So just to kind of round up here, there's a lot of new things out there right now. E-cigarettes, you hear about hookahs, we have pipes, pens. There's a new thing called, it's called gutka from Asia and betel quid from India. Then there's things such as just chewing tobacco, dip, all these things. Some people seem to have an idea that these things are less harmful to you because they're not cigarettes. That is not true. Especially chewing tobacco, that can lead to oral cancers. And then when you start looking at some of these new e-cigarette things, there are a lot of chemicals that the FDA have not thoroughly studied yet, and we don't know the long-term effects of that. And there's still going to be that addiction to those things. So our main goals that you want to take away here when you start talking about eliminating exposure to tobacco for you, you want to quit smoking, not both for your health and for your child's health, and that you want to raise tobacco-free kids. Ways that you can do that, we discussed that as a goal, and assist us nurses in going out and talking to your friends, talking to your family, anyone, and educate them and the general public about the dangers of smoking. Thank you very much.